Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. I am super excited about our guest today, Dr. David Lamond. He is the medical director of Blue Sky MD. Dr. Lamond is a nutrition, hormone, and prevention expert. Drawing from his foundation and board certification in family medicine, he has created the core medical principles behind the Blue Sky concept of total patient care. He is an active member of the American Society of Bariatric Physicians, American Society of Laser Medicine and Surgery, and American Academy of Family Physicians. He's been a featured speaker for numerous medical conferences and has been a consultant and has made several appearances on health television broadcasts. His written work has been featured in medical journals and other print media with a focus on insulin resistance, nutrition, non-invasive cosmetic procedures, and wellness. After years of development and thousands of successful weight control patients, he discovered a link between weight control and hormone optimization. This led to the development of a comprehensive hormone optimization program, which works in harmony with weight control and aging skin. His objective is total patient care and feeling great inside and out. Dr. Lamond is board certified by the American Board of Family Practice. We are so excited that he is here with us today, and we are talking about hormones, natural health, enhancing libido, everything hormones. Welcome, Dr. David Lamond. Thank you for being here.
Thanks for having me, Nicole.
Dr. David Lamond, he is a practitioner, medical director at Blue Sky MD right here in Asheville. And I know that you really help optimize male and female issues with hormones, weight loss. You also have a practice as well, a couple practices in the area, I believe, family practice.
Yep.
That you do as well. So tell me a little bit about yourself, how you got into hormones, and why you really particularly like helping people with those issues.
For sure, yeah. I've been in practice for about 20 years and started a primary care practice here in Western North Carolina, more specifically Hendersonville, south of here. And at the time, I felt like I knew everything, right? And my background really was in metabolism and sports medicine before coming here. And essentially, I spent some time listening to patients, talking about, their health and nutrition habits and so on and so forth. And I stumbled across hormone therapy indirectly because it was a time of great controversy. I'm dating myself here. This is about 20 years ago. And so after finishing school and residency and the training, hormones at that time were fairly taboo. There were a lot of people actually removing patients from hormone therapy, and we were talking more specifically about Women's Health Initiative data. And so there was just a lot of controversy at the time coming out, and so we basically said, no, we're not going to prescribe them in conventional medicine, basically, in that model. And so I was faced with a little bit of self-searching and research and listening to patients. I had, fortunately, a lot of time at that time when I was building a practice. Yeah, of course, yeah. Mm-hmm. And so I took that time to really dig in, and there was a particular patient who was in her 80s, and she basically said, if you take away my hormones, I am going to come find you and hurt you. So I said, okay, and specifically, she was on testosterone replacement therapy, and it had a pretty profound effect on her, and really specifically, she had RA and autoimmune processes, and it was very anti-inflammatory for her, and so we would try to reduce the dose and so on and so forth. And I really, at one point, just didn't want her. She was traveling to Georgia to get specifically hormone pellet therapy.
Wow.
And so I didn't want her on the highway anymore. So I called up a practitioner that she was going to see in Georgia. He actually was Dr. Greenblatt. He was in his 80s at the time. And he gave me the playbook. He really explained to me a little bit more about this, gave me a ton of clinical data that I wasn't exposed to, and it was really eye-opening. And so that set upon my journey. So, now I speak to women, and both men and women, a lot about their hormone health, and I would have laughed you out of the room 20 years ago when I first started my practice, for sure.
Wow.
Yeah.
So does she know what you've created since that 80-year-old woman, which is now 100?
Yeah, so she was a, part of the practice for over a decade, part of my life, and really influential, and, gave me a lot, she did know that process, and
that's great.
And how it kind of blew up.
Yeah, so, awesome. So was it primarily women in menopause that you were struggling with and trying to help?
It was, yeah. So kind of taking a step back, my primary interest back in the day was really more nutrition based. And so I applied, I spent a lot of time with patients speaking about their nutrition, trying to eliminate, medications, and really from the standpoint of thinking about things from metabolic standpoint. So we would actually measure someone's metabolism, get them in for consultation, and really apply, certain principles that I felt at the time were lacking, for better or for worse. And then we would create a framework around that. And so getting to your question, I think that hormone therapy in my practice specifically grew around interacting with nutritional and prevention health. It was really prominent in the practice, and more specifically weight loss. We had a lot of patients that were coming to us and saying, hey, how do I lose weight? And so I started getting more and more into the link with hormones and weight balance, and really as a part of that. And then nowadays, I would tell you that 3/4 of the patients come to us and they say, hey, I want to lose weight, and about 1/4 of the patients come in and say, hey, I know that I might have something going on with my hormones, and I hear you guys do that, so can you help me?
And it's really one and the same.
It's
most of the time you can't lose weight because of what's happening with cortisol and all the other hormones out of balance. So that does go well, pairs well together.
Sure.
So your practice now, a patient comes in, do you primarily see any one age group? I know you see male and female.
Yeah.
What's the most common age that comes in?
I would tell you that 2/3 of our patients are female, just because I think they're a little bit more proactive with their health, to be perfectly honest. And most people are coming to search us out, so they're fairly proactive. And I would tell you it's middle-aged folks that are generally speaking fairly well, but we do have extremes. I have some people in their 20s and some in their 80s, beyond. So
we all have hormones.
Absolutely.
And that's the thing. The misconception is once you have a hysterectomy and they take your ovaries as well, you don't need to worry about hormones anymore. And that's a big misconception.
Absolutely.
You will have hormones forever. I mean, parts of your body make hormones, and those hormones really protect you from cancer and chronic degenerative diseases. So we need to keep those hormones alive and well. It always upsets me when I hear, especially young females, really, downplay or kind of talk negatively about their cycle and their hormones. And mainly it's because of what society has taught us, I think, and the fact that we don't understand our bodies. From a female's perspective, we really, no one's taught us how our hormones are cycling throughout the month, and that we need to eat a certain way during the month, and we need to nurture ourselves this week, but really go hard this week, or socialize here, but recluse and nurtured here. So I think we need to talk more about our hormones, which is why we're doing this.
Absolutely. Yeah.
And sharing this information. So,
Great.
Okay, any age. So what would you say symptom-wise? Are the symptoms all over the place in terms of what people most commonly come see you for? Or
I would say, yeah, there's certainly a cluster of symptoms, and definitely they're all over the place. But when you hone in on it, people want to sleep better. They want to, in general, feel better, and that could be, hey, I have a little bit of brain fogginess, I lack energy, drive, motivation, what have you. Certainly people have libido issues. That certainly is part of it. Obviously, weight balance, skin, hair health. Those kind of things come into play as well. So.
And all of those are signs of your hormones being not balanced. We think we're just getting old. I'm in my mid to late 40s and I'm tired all the time. It's just my age, and we're here to tell you that it's not. It can very well be hormone imbalance, and most of the time is, right? We shouldn't just die off because we've reached a certain age. We should learn how to get in sync with our bodies more and feed it what will help the hormones do what they need to do, cycle appropriately.
Absolutely.
So patient comes into your office, and I know that you do things a lot different than most medical doctors, which is what I love about you. I really respect that you think outside the box, that you've created this amazing practice and business, and it's, how many offices do you have now doing Blue Sky?
We have 9 total offices. We're in throughout North Carolina. Yeah, and so I spend a lot of my time working with our other providers. So we've got, at this point, 20 different providers.
Yeah.
Across all the offices.
I mean, you're doing something right?
Yeah,
So
yeah, it's cool.
it's amazing. So I appreciate that. So typically when women or men have symptoms, they go to their medical doctor, whether it be their family physician or their OBGYN, and they share with them what's going on symptomatically, and oftentimes they're maybe given an anxiety med or a sleep med, but that's usually where it ends, and that's it. So you do things very differently. What are some of the things that you look at when a patient comes in with these kind of symptoms? I'm depressed, I can't lose weight, I have no energy, I can't sleep.
Absolutely. So, and you teed that up perfectly for me, so thank you. But really and truly, so I think in conventional medicine, yes, what we're trained to do, what conventional training really is first you're trying to figure out, you're listening to symptoms. You may end up treating the symptoms as you kind of refer to, and when you really look up the most common medications used, they're treating symptoms, not really necessarily underlying cause. So, and providers are good and our training is solid. So when you think about someone that gets really, really sick, so there's this continuum of health, call it. So we look at things with a very narrow scope. So I would tell you that most providers have good intention, when I say
absolutely.
provider, absolutely.
Yeah.
And so what we're trained to do is look for abnormals. Mm-hmm. So, and that might involve a test or a lab or a study. And then oftentimes, and especially in primary care type practices, people come in, they have complaints like you're describing, and then we're told, okay, we're good providers, we're going to work that up, so to speak, right? Mm-hmm. So we might order some testings, take a look at you, so on and so forth, and lo and behold, what happens? Yes, everything comes back normal, mm-hmm. right? It might be suboptimal in the lab, but normal,
right?
And we'll continue to watch it, or we might treat your symptoms. Really, our approach is there's this continuum, so we might take a lab and look at it a little differently and say, well, this is actually suboptimal. And when you look at a range of normal labs, you have to be traditionally 5% in the worst 5 percentile mm-hmm. to have an abnormal on a lab. So whether it's a blood sugar or an abnormal cholesterol value or a hormonal value as well, we wait till you're really, really symptomatic or really, really actually sick at that point. Mm-hmm. And so we spend time working with patients that are symptomatic, looking at that underlying cause, and so call it, there's a continuum of normal, say on a study, and then put all that together into a care plan and then give patients option. And the care plan, and I can kind of touch base on some of that. That usually involves lifestyle, right? So we start with digging into, well, what's going on? Where are you? What, and it can be not only from a standpoint of nutrition, but we also look at environmental factors, what's happening at home, how are your
Stress.
relationships, stressors, all these kind of things. We may make natural interventions as well. I would tell you that on that continuum, we're fairly focused, and then we also look at what are other options, from a hormone standpoint or other what I would call traditional interventions if need be. So
Yeah.
that's kind of the stepwise order too.
And the natural, it would be like a compounded formula of some kind of hormone, estrogen, progesterone, something of that nature.
For sure.
Yeah. And what I particularly like about what you do is you create that specific to the person, which is also something that we tend to not do in Western medicine. And I'm not here to just bash, but I just want to show the difference and why what you're doing is blowing up and is doing so well. It's unique to each person. So the blood work shows a deficiency in a couple of hormones, and then you will create a formula, if you will, of something that's unique to this person and monitor them over time, and that may need to be adjusted, but that may be part of their treatment.
Absolutely.
Yeah.
You nailed it.
Yeah, which I think is great too, because we're all different and unique, for sure. So so I think it's wonderful what you're doing. We've been talking about hormones all month long in my practice, and one of the main topics that we've been talking about is libido, and we've been trying to embrace that, love your libido this month. And if you don't have one, that's a problem in and of itself, and indicates definitely some kind of imbalance, most likely a hormone imbalance in the body. So let's talk about that specifically, just because we've been on that subject. Men and women should have libido for how long of their life? Should it die off?
No, it shouldn't really. That's you bring up a great point. Yes. I mean, and you'd be surprised at the conversations we might have in the room, which are awesome that folks are comfortable doing that. But so I would say that yes, that's certainly a common topic that we deal with, and yes, it's across the continuum for sure.
It's important,
Absolutely.
It makes us happy. But you hear people say, my grandmother, she's 80 or and she's got a new boyfriend, and all they talk about is having sex, and it's so weird. Do you really have sex at that age? And it's like, well, why wouldn't you?
Right.
Yeah, of course. So it shouldn't be an oddity. It should be something we look forward to. When we don't work, we have nothing more to do. Right? But yeah. So lacking libido, what particularly, from a physiological standpoint, from a hormonal standpoint, for a man, what could that mean?
Yeah, I mean, oftentimes for men, right, it can be multifactorial. So when we work it up, we normally check a testosterone level and a free hormone level as well. So we also look at accessory hormones. So for men, both men and women have testosterone and estrogen, just different ratios. And so we look at the estrogen level as well. And those are really the cardinal hormones that we take a peek at regarding libido in men. But they're secondary hormones, so they all interact as well. Certainly when you control for things like insulin resistance, that's helpful. Or sometimes you might have mild thyroid abnormalities or cortisol and so on. So we do look at that. One of the other ones that we take a peek at is DHEA levels, especially because that's implicated in libido.
Yeah.
And we do replace that. It's simple, it's affordable, it's cheap. And it also secondarily is a reflection on indirectly cortisol, fairly practical.
Yeah, so some men listening to this, they might, be listening in because all of a sudden they hear low libido, I've got that, and I've been taking these testosterone supplements I picked up, on the internet, when it may not be the testosterone. It may be the fact that your diet is filled with, sugar and, foods that tend to cause that insulin to spike and can affect your testosterone levels. So So it's not that easy. How about for a woman, libido, low libido? What could that mean?
Absolutely. So women are a tiny bit more complicated, but yeah, we definitely check on a lot of the same. So again, it might be a testosterone level, estrogen level. We also take a peek at progesterone level specifically in women, and DHEA level as well. Additionally, a lot of the lifestyle things. There definitely is an attachment, process. How's your life, and a little bit more of that aspect, I would say, with women for sure. And different interventions that we do. So we might use beyond kind of the classic hormone therapy, which would include estrogen, balancing estrogen, progesterone, testosterone, DHEA, oxytocin's another thing that we kind of look at and take a look at if that's an option, and so on. So
yeah. I was just reading about that, how the cortisol can stop testosterone dead in its tracks.
Yes.
So for a woman, if you're, tend to be stressed out, or you let things get to you, especially during the time of your month where testosterone should be spiking, which is like 14, around there, day 14, then, you may not produce enough, and then there goes your libido. And here you think there's something wrong with you, when really what you need to do is get on the phone with a girlfriend, get that oxytocin level up, go pet your animals, do things that help you feel nurtured, that things that raise your level of oxytocin, and that will help balance that out. So there's definitely natural things that you can do. Speaking of natural things, are there any suggestions or tips that you would have for people listening regarding libido, male or female? What natural supplements or anything like your go-tos?
Yeah, there's a host of things that we do. In terms of supplements, that we tend to not use quite as many supplements, to be honest.
Really?
And a lot of the reason is because underlying cause, right? So we get back to the hormone balance. Often the hormone balance actually works really well. And then certainly getting into mood and kind of prepping into, what are you doing socially? Are you checking in? Are you doing the right things like that? But certainly, in terms of, conventional things that we do, we might think outside of the box as well, because there's a continuum with ED stuff. So for men, we do work on that as well. For women, again, oxytocin and some other supplements that augment that, are what we are kind of the primary mainstays, to be honest.
But really getting to the core, getting to the cause of the problem and fixing that. And it's always, and I say this to patients all the time, so it's funny that I asked you, went against what I typically talk about with patients, but everyone's always looking for something to take, because that's just what we've done. That's Western medicine. That's what we do. Something hurts, something's not right, we take something to hyper the hypo, and just get us back to homeostasis. But sometimes it's not what you're putting in, it's what you're leaving out. It's the foods that are toxic and poisonous, it's the chemicals, it's the stress, it's it's the thoughts. So it's oftentimes, something that you have complete control of. You just need to not let it enter your body. So,
absolutely.
Yeah. So if somebody's listening to this and they're local in Asheville, how can they find you if they want to set an appointment?
Yeah, we're online, so at blueskymd.com, and we have the ability to book patients online, and so that you just click the location that you want to see, and then or you can just give us a call. It's easy.
Awesome. Yeah. Do you do virtual
work as well? So we do in person and virtual. Still seeing about 10 or 15% of our patients virtually, so for sure.
Okay, so somebody that's not local or near one of your locations can get set up and get help.
Absolutely.
Yeah. Cool. Awesome. Well, I really appreciate you being here and sharing this information with us. We'll email this out to our patients as well. And if you have any questions for Dr. Lamond, please don't hesitate to reach out to us. We'll pass it on to him, or you can put it in the comments section here, and hopefully he can answer those in between his busy schedule. So thank you again for being here.
Yeah.
Thanks for watching. We appreciate you, and let us know if we can help you with any chiropractic needs. Thank you so much.